Climate change and health. We will be speaking about climate change and health in this video. Welcoming one and everyone to this videos. Climate change harms human health in plentiful of ways. Extreme weather events like heat, floods, droughts, storms, wildfire caused by climate change can lead to illness and injuries and even death. Climate change can worsen the spread of disease by insects and ticks. Climate change can affect the quality and the safety of air, water, and food. Climate change can definitely and negatively impact the mental health. Air pollution from climate change can worsen heart and lung diseases. Low income communities, people of color are actually more vulnerable. Heat waves caused by climate change are expected to become much more frequent and intense, leading to more heat related illness and death. So, impacts mental health. Climate change increases the frequencies and intensity of extreme weather events, putting first responder at risk of mental health problems like depression, anxiety, and PTSD, post-traumatic stress disorder. Access to healthcare. Extreme weather events can make it harder for people, especially in rural areas, to access medical facilities due to the damaged infrastructure or limited transportation option. Water quality, rising sea level, contaminated groundwater system with salt water, especially in the Pacific Island communities. Air quality, climate change worsens the air pollution, increasing the risk of heart, lung diseases. Low income communities and people of color are actually more vulnerable due to living near pollution sources thereby. The link between health and climate change per se. What do we look into it? Climate change can disrupt the access to health care services, threaten infrastructure, and pose physical and mental health risks. However, healthcare facilities also emit greenhouse gases with into the atmosphere that can contribute to the climate change, reducing greenhouse gases GHGs from these facilities can reduce the overall cost of healthcare, benefits of economy, and saves lives. The top climate impacts on health, threats to safety and health from extreme weather, threats to water, food, and air quality, insect and tick related diseases, threats to mental health and well being thereby. The health and economy. Health comprises health conditions, short term or long term, can negatively impact people's ability to work, attend school, maintain social relationships. Economy. Poor health leads to missed work days and lost wages, costing US employers billions of dollars annually. Certain social and economic factors make some people actually more vulnerable to climate changes. Low income household may be inadequate housing and resources to cope with extreme weather. Native American, Pacific Islander, Alaska Native communities may face food insecurities and mental health issues due to disruption in traditional food sources. Immigrants and communities of colors may face language barriers and discrimination that hinders preparedness and access to information. People with chronic illness or disabilities may struggle with disruption to medical care and inaccessible emergency warning. These groups are more likely to experience negative health consequences from climate change due to existing vulnerabilities and limited resources thereby. So, what can we do for maintain good health? Seek medical care, get to know your community, learn about the local waterways, go for green campaign, protect against insects and ticks, improve the quality of air indoors. Now, this is what we are looking into it. We trying to innovate, probably come find solution through scientific means, as in what can be done, how can we optimize the productivity at the same time have minimal to negative impact, absolutely zero impact on the environmental. So we need to invest in those solution technology. We need to work with the scientists, the researchers, the engineers, the public organization, the private organization, so that we come to a solution, arrive to a solution which is a win-win for every one of us, for the whole of the ecology, the environment, for all of the flora and fauna present on the planet. So how does the World Bank tackle the climate-driven health crisis? Something very simple. The goal is to increase investment in climate health action. Strategies is integrate climate consideration into existing health programs, strengthen health systems to prepare for and respond to climate threats, reduce the health sector's own carbon footprint, address the root cause of climate change through cross-sectorial collaboration, focus on adaptation. 80% of the investment target urgent needs like nutrition support, disease surveillances, and emergency responses thereby. So, example of successful initiatives. Let me quote Madagascar using climate data to target food security investment for vulnerable population. Yemen and Haiti strengthening disease outbreak surveillances and response system. Nagaland, that is in India, providing solar power solutions to health facilities, improving service continuity, and ensuring reduced emissions. So, how climate changes affects the human beings, us for that matter? Direct impact means it is all about injuries, diseases, deaths due to extreme weather conditions. You name it, and we have it due to hurricanes, due to storms, due to tornadoes, floods. Probably, if we can have some kind of indigenous treatment for people as expected to suffer around here, aggravated circulatory, cardiovascular, respiratory, kidney diseases, as the case might be. Indirect impact is all about your airway diseases, allergens that we suffer from time to time. Diseases such as asthma, allergic respiratory, increased cardiopulmonary mortality due to high particulate matter, suspended particulate matter, remember, in the atmosphere. Then we have the food and waterborne diseases. It is projected to increase over a period of time. Accelerated microbial growth, survival, persistence, and transmissions of pathogen, shifting of geography and seasonal distribution of cholera. Vector-borne diseases, definitely yes, you will see a lot of vectors which are carrying and probably infecting human beings. Let's take the example of coronavirus. Let's take the example of malaria. A warmer climate will increase the reproduction rate and resilience and distribution of the vectors per se. The indirect impact through socioeconomic system is food and water insecurity, which will actually lead to undernutrition, increased risk of undernutrition because of the lower food production. Combined effect of undernutrition and infectious disease, people will become much prone to be susceptible to diseases. Occupational health and vulnerable population, risk of heat exhaustion, cardiac arrest, and more frequent work accident for outdoor activities. The elderly, children, and the people living in the poor environment, forced displacement, mental illness, increasing of stress on those who already are mentally fit per se. With this, I come to an end of this video. Thank you for watching this video till the end.